Hi, this is Dr. Neal Schwartz. Since the inception of the video gallery in 2007, people have asked me the seemingly simple question, what is the cause of acne? I will answer this age-old question today in such a crystal clear manner that hopefully this conversation will forever be put to rest. Once this inquiry is fully resolved, acne sufferers will be able to grieve properly over their current situation and move forward in their pursuit of total inactivation and satisfaction. So without further delay, I present to you my clinically derived, non-theoretical, firm stance on the quote, cause of acne. To understand the cause of acne, you will first have to understand that there is no cause, no cure, and no magical source of your acne. The cause of your acne is your humanity itself. Every single person on earth is prone to acne in some degree on a bell-shaped curve. The condition you are suffering from is the same condition that people were emotionally reacting to in the 1950s. It has been battled throughout our history and has forever been mentioned in association with humans walking on this planet. The degree of acne proneness is originally set up by both your inherited skin type and your development, both in utero and as a child. The people on the left side of this curve are less acne prone, and the people on the right are more acne prone. The bell curve is made to show how populations have averages and extremes. Notice there are less people at both extremes. There are very few people on the far left who have never noticed a pimple in their life, and there are very few people on the right that have had to come to this practice after failing Accutane more than 4 times. The middle of the curve represents those with mild pimples occasionally, who are more easily satisfied with age-old topical preparations. It is this average majority that is responsible for minimizing the emotional effects and difficulties of acne. The reality is that regardless of motivation, nutrition, fitness, and hygiene, it is easier for some people to beat than others, period. My recommendation is to first grieve and deal with this reality, and then do whatever is needed to fix your specific situation. As proven by the video gallery, there is no location on the bell curve that is not treatable to total inactivation and satisfaction. There is a large post-Accutane playlist on the homepage for those who still think they are all alone in their repeated failure. Chapter 2. The concept of aggravating factors. Now that you understand your own humanity and understand that acne has been around since the dawn of mankind, we can unemotionally discuss all the aggravating factors of acne that are oftentimes misconceived as causes. The first aggravator we'll talk about is stress. What is stress? Stress represents a physiological reaction that can't be properly contained nor harnessed by an individual's coping skills. This chemical reaction can come from physical trauma, fear, loss, anger, work, medical illness, etc. The reaction can also occur with overexcitement or manic reactions that can't be fully contained. The subtle buzz of stress is the most powerful aggravator of acne in my experience. It has the power to take someone on the far left side of the curve and blaze them open with a huge breakout. A stress-induced flare of someone from the left side of the curve usually sounds like this clinically. Quote, I never had acne my entire life until I got divorced at 34. Since then, my face and my life have been a mess. Although stress in this example is the main aggravator, the cause is still the person's humanity. It just got flared up by the stress. When someone further to the right side of the bell curve is stressed, it usually sounds like this clinically. I have always had acne to some degree, but since I've been cramming for finals this week, my acne is much worse than ever. To make matters worse, the emotional stress of dealing with acne also directly aggravates the situation, and thus we have one of the toughest downward spiraling conditions known to mankind. For many good reasons, there is much talk and passion in the world of nutrition these days. Rather than to get everyone manic on the magic food or food restriction that will cure you, I like to place this aggravating factor within the conversation of stress as mentioned prior. Think of it this way. Having great nutrients decreases the workload and stress of the body's maintenance, and eating unconsciously and recklessly causes more stress on the functioning of the body. When you think of the art of nutrition in terms of stress-inducing or stress-relieving, you'll start to understand how the body works. There is no one magic food, and there is no one demon food. Think like an artist, and consciously paint every detail of your life under manual control, rather than by habit. Avoiding foods that aggravate your skin is a good idea for now, but always know that a person in tight control of their skin can eat anything they want without immediate consequence or fear. Many people in this practice continued to eat unconsciously and still became completely inactivated. Furthermore, many ultra-conscious health food enthusiasts have come into the practice with full faces of active acne, and expectedly, they were baffled by the situation. Go figure, food is not the cause of acne. This is further proven by studying the eating habits of people with healthy skin. You'll find countless individuals with beautiful skin that have very poor nutrition. Food is simply a potential aggravator for those who are not in total control of the overall situation. Those who desire a great life full of energy, a balanced mood, and disease prevention are cleverly making good food decisions every single day. I personally feel much more energetic when I eat nutritiously. However, even with a 20-year history of acne proneness, I am also not afraid to indulge in any food at this time. The third aggravator we'll talk about is fitness. Also think of fitness, or lack thereof, in the same context as stress. Those who are in great cardiovascular shape are more resistant to every stressor in life. Those who are sedentary are vulnerable to every common stressor in life. I can't emphasize this enough. If you are not breaking a sweat every single day of your life, prepare yourself emotionally for all the predictable chronic conditions that are headed your way sooner than later. Type 2 diabetes, high cholesterol, high blood pressure, depression, anxiety, insomnia, joint pain, and impotence will come to all those who are sedentary. That is a promise. It's so painfully predictable, and I'll keep mentioning it until it becomes common knowledge. Now, if sweating and cardiovascular exercise is currently aggravating your acne, know that you are at risk of making a bad decision. If you mistakenly choose to give up sports for any reason, know that you have just condemned yourself to a lifetime of depression, and furthermore, your acne will still not be in total control just by avoiding this activity. The solution is knowing that once in total control of your skin, you will be able to participate in any physical activity, even with sunscreen slathered all over your face. The fourth aggravator is your skincare routine. An inappropriate or poorly managed skincare routine can aggravate a current acne condition. Many people are not taking this condition very seriously and making their acne worse every day while trying to fix their skin all by themselves. Asking for assistance from a real expert can be make or break for many acne sufferers. Just a heads up, this can be a dangerous condition both physically and emotionally. As we uncover the concept of cause versus aggravation, you begin to realize there is an unending list of aggravators that have been misconceived as causes. For example, hormonal changes, the sun, the cold, humidity, makeup, dirty air, dirty sheets, phones in the face, rubbing your face, and countless other activities are all aggravators only for skin that is not in great control. Know that when your skin is in total control, you can have a massage therapist rub your face for hours, and you can mash your face into an old pillowcase without fear or consequence. Know also that women who are in total control of their skin can have menstrual periods without a breakout. Those who are only in partial control going into their monthly cycle are at risk of a, quote, hormonal breakout. The lesson here is that it's all just aggravation of plain old acne. So we have the bell curve of humanity, aggravating factors, and a third concept to discuss today in explaining the cause of acne. The third concept is that of, quote, delayed treatment or duration of activity. You see, the longer the skin remains out of control, the more stubborn the condition becomes. Similar to all chronic situations like obesity and bowel trouble, the, quote, persistence of imbalance or time with active inflammation can create a new set point for the skin that makes it more resistant to change. When your skin remains untreated or mistreated for many years in a row, expect the skin to behave differently than it did 5 years prior. Not permanently per se, but for a while until a new, more balanced set point can settle in. In other words, it has to be inactive for a while before behaving normally again. I have witnessed this time-sensitive phenomenon of chronic conditions for many years. The dermatology community has also observed this pattern, and I recall many other doctors saying, quote, for acne, treat swiftly and start treatment at the earliest stage possible. So let's review the bottom line here to end all confusion regarding the cause of acne. Number one, There is no cause nor cure for any chronic inflammatory condition of the human body. Our specific goal is to achieve total inactivation, emotionally heal from the ordeal, and efficiently maintain the balance. Number 2, the 3 main components that make up an acne situation are hereditary, aggravating factors, and duration of ongoing activity. Number 3, now that you understand the cause of acne, you can focus all your energy on the battle towards inactivation without fear, distraction, or hesitation. I wish you well in your pursuit of victory. If conventional approaches are not bringing you total inactivation and control, my practice is available and devoted to resistant, allergic, and stubborn cases. I'll be here. Have a great day.